Have you ever wondered what it would be like to hear voices that others can't hear? Imagine it for a moment. This isn't about an imaginary friend from childhood or a whispering wind, but rather a persisting, tangible presence that only you can perceive. Here, we are introducing the topic of schizophrenia, a complex and often misunderstood mental disorder. This is more than mere curiosity, it's about understanding and empathy. Well, for some, this is not just a thought experiment, but a daily reality. Welcome to our exploration of schizophrenia. Schizophrenia is a serious mental disorder affecting millions worldwide. This complex condition is often shrouded in misconceptions and stigma, making it all the more important to understand what it truly is. At its core, schizophrenia is a chronic mental health disorder characterized by disruptions in thought processes, perceptions, and emotional responsiveness. It's not an exceedingly rare condition as it affects nearly 1% of the global population, which equates to millions of individuals around the world. Yet, even with its relative prevalence, schizophrenia is often misunderstood. Let's take a moment to debunk some of the common myths about this disorder. Firstly, schizophrenia does not mean split personality. Despite what popular culture might suggest, schizophrenia is not about having multiple personalities. It's a disorder that affects a person's ability to think clearly, manage emotions, make decisions, and relate to others. Secondly, schizophrenia is not the result of poor parenting or personal weakness. It's a biologically based disorder with a complex interplay of genetic and environmental factors. Blaming the person with schizophrenia or their family is not only misguided but also harmful. Thirdly, people with schizophrenia are not necessarily violent or dangerous. While some individuals with severe cases might exhibit aggressive behavior, it's essential to note that this is not the norm. Most people with schizophrenia are more likely to be victims of violence rather than perpetrators. Finally, schizophrenia is not a life sentence of endless hospitalizations and decline. Many people with schizophrenia can lead fulfilling lives with the right treatment and support. They can study, work, have relationships, and participate in their communities like anyone else. So, what does this all mean? It means that we need to approach schizophrenia with empathy and understanding rather than fear and judgment. We need to recognize it as a health issue, not a character flaw or a moral failing. Schizophrenia isn't a split personality or a rare condition. It's a complex, often misunderstood mental health disorder. And it's time we understood it better. Schizophrenia manifests in different ways, but there are common symptoms. To understand this complex mental disorder, it's crucial to understand the primary symptoms, which often fall into three categories: hallucinations, delusions, and disorganized speech or behavior. Firstly, hallucinations. This symptom is not just about seeing things that aren't there. People with schizophrenia might also hear, smell, taste, or feel things that others can't perceive. An individual might hear voices conversing or commenting on their actions. These voices can seem so real that they're often mistaken for actual people. Next, let's discuss delusions. Delusions are firmly held false beliefs that aren't based in reality. A person with schizophrenia might believe they're being persecuted, that they possess extraordinary powers or wealth, or that certain gestures or comments are directed at them. Delusions can make the world seem threatening or confusing. Lastly, we move to disorganized speech and behavior. People with schizophrenia often have trouble staying on track during conversations. Their sentences may not follow a logical pattern, making it hard for others to understand them. Their behavior can be similarly disorganized. They might struggle with routine tasks like cooking a meal or maintaining personal hygiene. They may act inappropriately or unpredictably, like laughing at a sad event or showing no emotion at all. It's essential to remember that these symptoms vary from person to person. Some people might experience only one or two of these symptoms, while others might experience all of them. The severity and frequency of symptoms can also differ widely. You might be thinking these symptoms sound intense and difficult to live with. And you're right, schizophrenia can be a challenging condition to navigate. It can cause significant distress and can disrupt one's ability to function in daily life. But it's not all doom and gloom. With the right treatment and support, these symptoms can be managed effectively. In the next scene, we'll delve into the causes of schizophrenia, another crucial piece in understanding this complex condition. But for now, let's pause and remember, these symptoms can be debilitating and disruptive, but with the right treatment, they can be managed. What causes schizophrenia? Well, it's a combination of factors. Let's start with the biological factors. Our brains are complex and intricate, and the slightest alteration can have significant effects. In people with schizophrenia, there's often an imbalance of neurotransmitters, specifically dopamine and glutamate. Genetics also play a role. While no single gene causes the disorder, a combination of several genes may increase the risk. Furthermore, complications during pregnancy or birth, such as malnutrition or exposure to viruses, can contribute to the development of schizophrenia. Moving on to psychological factors, they are not causes in themselves, but can trigger the onset in people who are genetically predisposed. Stressful life events, such as a bereavement, losing a job or home, a divorce, or the end of a relationship, can often act as triggers. Additionally, childhood trauma or abuse can make a person more susceptible. Lastly, let's consider the environmental factors. Growing up in an urban environment, particularly in deprived areas, is associated with a higher risk of developing schizophrenia. This may be due to increased stress, social isolation, or exposure to certain infections. Substance misuse, particularly cannabis, is also a significant risk factor. It's important to note that these factors don't work in isolation. They interact in complex ways, creating a unique combination for each individual. For example, a person might have a genetic predisposition, but only develop symptoms after a traumatic event or prolonged substance misuse. While we've covered a lot of ground, there's still so much we don't know about what causes schizophrenia. Research is ongoing, and every new discovery brings us one step closer to understanding this complex disorder. Remember, having one or even several of these risk factors doesn't mean you'll develop schizophrenia. It's a complex condition that requires a specific set of circumstances to manifest. While the exact cause remains unknown, it's clear that schizophrenia is not the result of one single factor but a complex interplay of many. Despite its complexity, schizophrenia is not a life sentence. There are treatments available. Let's delve into the different ways schizophrenia can be managed and treated. First on the list is medication. Antipsychotic drugs are commonly prescribed to help manage symptoms like hallucinations, delusions, and thought disorders. These medicines work by affecting the brain's neurotransmitters, particularly dopamine and serotonin. It's important to note that medication plans are highly individualized, and what works for one person may not work for another. It's a journey of trial and error to find the right balance. In addition to medication, psychotherapy plays a crucial role in treatment. Cognitive behavioral therapy, or CBT, is often used to help individuals with schizophrenia deal with their symptoms. This type of therapy focuses on identifying and changing harmful thought patterns. It helps patients understand their symptoms, reduce distress, and improve their ability to function in daily life. Family therapy is another form of psychotherapy that can be beneficial. It involves the patient's family members and focuses on improving communication and relationships within the family unit. This support can be invaluable in managing schizophrenia. Another key aspect of treatment is community support. This can take many forms, from support groups to specialized employment services. Support groups often provide a safe space for individuals with schizophrenia to share experiences and coping strategies. Employment services, on the other hand, can help individuals find and maintain a job, fostering independence and a sense of purpose. Self-care is also a major component of treatment. This includes maintaining a healthy lifestyle, like regular exercise, a balanced diet, and adequate sleep. It's also important to avoid alcohol and illicit drugs, which can exacerbate symptoms and interfere with medication. Lastly, hospitalization may be necessary in severe cases or during crisis periods. This provides a safe environment where the individual can receive intensive treatment and care. It's a multifaceted approach, combining medication, various forms of therapy, community support, and self-care. It's about more than just managing symptoms. It's about empowering individuals to lead fulfilling lives despite their condition. With the right treatment plan, individuals with schizophrenia can live fulfilling and productive lives. Before we wrap up, remember these essential points about schizophrenia. This complex mental health disorder is characterized by a profound disruption in cognition and emotion, affecting the most fundamental human attributes: language, thought, perception, and sense of self. It's like a storm in the mind, distorting reality, producing hallucinations, delusions, and disorganized thinking. Symptoms vary widely but generally fall into three categories: positive symptoms like hallucinations and delusions, negative symptoms such as reduced feelings of pleasure in everyday life, and cognitive symptoms like trouble focusing or remembering. These symptoms can be frightening, not only for those experiencing them, but also for those around them. The causes of schizophrenia are not fully understood, but it's believed to be a combination of genetics, brain chemistry, and environmental factors. There's no single schizophrenia gene. but rather a complex interplay of genetic and environmental influences that can increase the risk. And while there's no cure for schizophrenia, it is treatable. Treatment typically involves a combination of medication, psychotherapy, and social support. The goal is not only to reduce symptoms, but also to help individuals lead fulfilling, independent lives. Remember, schizophrenia is not a person's identity, it's a part of their life, not the whole of it. Understanding schizophrenia helps us to empathize with those affected and to fight the stigma surrounding mental health. Knowledge is power, and you now possess that power.